Dr. Darpinyan mentioned about World Health Organization regulations, and we are happy today to have with us Dr. Elisabet Paunovic, who is the Program Manager for Environmental Exposures and Risks in the World Health Organization European Center for Environment and Health. Dr. Paunovic is managing multiple environmental and occupational exposures and risks, and in particular the areas dealing with air quality and noise, chemical safety, environmental health inequalities, housing, and urban health.
Good morning, ladies and gentlemen, and first of all, I would like to thank the organizers for inviting WHO to participate at this conference, and on behalf of WHO European Center for Environment and Health, I would like to wish you all the best with the conference and really to welcome this initiative on addressing these important health risks that are posed by the activities within the mining sector, both for workers' health, occupational health risks, as well as environmental risks. I'm coming, as Professor Petrosian already said, from the Bonn Center for Environment and Health. And just let me say a few words about the center. This is a WHO European Center of Excellence for environmental, including occupational risks for health. There are 26 professionals employed there, and we are organized in 4 programs dealing with classical risks like water and sanitation, then environmental monitoring and intelligence and forecasting, climate change and green health services, and environmental exposures and risks. When the organizers have been so kind to invite WHO for this conference, I have been discussing with my colleagues what should be the most appropriate to present today. And in fact, we have decided that when we are addressing to environmental and occupational risks, it is very important to have a good framework for establishing main infrastructures, as well as to have a framework for the activities which will be performed under this framework. So the starting point for all WHO activities are in fact to reach and to support the enjoyment of high attainable standard of health for all the people. And this is our main starting point. I think this is the main starting point for this conference today. So in my presentation today, I will give a brief overview about the burden of occupational diseases and injuries in WHO European region, and especially to point out on sub-regional disparities in health. Then we'll give you a brief info about WHO response under the Global Occupational Health Framework for Action, and Deputy Minister already mentioned the Global Plan of Action for Workers' Health is the main document that Armenia is following in shaping occupational health activities. So I will give a few info about this document. Info about the main European strategic document on public health strategy health 2020, and some concluding remarks maybe as the framework for the discussion later on. This is the situation expressing burden of occupational diseases and injuries in WHO European region. These are data for WHO Burden of Diseases report from 2004, updated in 2008. And we can see that the occupational, environmental and occupational risks are amongst first 10 health risks. And similar situation is, for example, but it is a little bit different, expressed in the new Burden of Diseases paper published in Lancet. So in some subdivisions there are some differences, but in general this is the situation, and we are usually addressing to the epidemics of non-communicable diseases by pointing out to the lifestyles and other factors, but very often we are forgetting in the wide actions that are implemented within the countries or within the region, we are quite often forgetting to address to environmental and occupational risks. Here is the situation expressed in DALIs, burden of occupational diseases and injuries in WHO region from the same source, but as the disabled adjusted life years. And in fact, we see a little bit divided situation, but we have occupational injuries, carcinogens, airborne particulates, ergonomic stressors, and noise and its share in disability. So which is the attributable fraction of work-related diseases to NCDs? Because yes, we are facing with NCD epidemics, but we have to address to all the factors that are causing. In WHO European region, between 6 to 14% of all lung cancers, in fact, and we can say all mesothelioma, are due to occupational exposure, according to Tim Driscoll's paper published in 2005. And 42% of obstructive pulmonary disease are appearing due to occupational and environmental factors. So we can say that there is a huge variation between the countries and WHO regions and sub-regionally within WHO European region, but this is just to get the impression that why it is important to address to all these risk factors. As it is already mentioned in the discussion, activities in the mining sector are presenting very particular risks, also having in mind occupational cancer. And my colleague Urs Streif from IARC will have a presentation later right on this topic, but I would like just as a brief introduction to say a few words about the extent of the problem. We can say that when we are talking about the worldwide situation, about 12.5 million new cases and 7.6 million deaths in 2008 have been caused by cancer, and we can say that globally about 19% are attributable to environmental risks, including work settings, and resulting in 1.3 million deaths each year. So we have to keep this in mind. There are more than 100 agents classified by IARC as occupational, as carcinogens to humans in general, and some of them are occupational, and some of them are appearing in the activities in the mining sector. We can also say that every 10th lung cancer death is closely related to the workplace, and lung cancer, mesothelioma, and bladder cancer are amongst the most common types of the cancer, occupational cancers. So just in brief, and Kurt will have a very detailed presentation on these topics. I would also like to say a few words about the disparities in health, and in particular disparities in occupational health this time. I don't know how clear you can see, but just to show you, these are deaths due to work-related accidents per 100,000. And in green, we have EU member states, so-called old EU member states, and this is the lowest here. Then we have in red the average for European region, in blue are new European member states, And here in yellow, we have the situation, let us say, in the rest of the region. What does that mean? Southeastern European countries, Central Asian countries, newly independent states. And we can see that there are huge disparities in the region, but in connection with this, before I start explaining this slide, I would like to mention that these are the data from European Health for All database 2011. In European Health for All database 2012, you will not find any data on work-related injuries. Why? Because the member states are not reporting. Or this part, which I have shown you, EU member states are following up and reporting. The other part of the region is what we are getting as the data is not sufficient to be compared and commented and taken into account as the real situation. And when we say it's not reported, I mean the situation is much more serious. They are not detected, the victims are not compensated. So we should really pay a particular attention in this part of the region on work-related injuries and occupational diseases. The same situation is with similar situation with occupational diseases. So when we say that there are no data, that means also that it implies also that the detection is not performed in a quite desirable way. I would like also to point out how to address to these issues, and we are coming to this global and international framework for the national activities. These are two approaches, and here when it is said occupational health, it's not meant the occupational health as the medical and scientific discipline. Occupational health as the medical and scientific discipline, of course, has its own expertise. This is meant in the more in a policy point of view, and WHO is promoting, in fact, health approach, public health approach, and more workers' health, that it is beyond the labor contract and for all workers. There is a huge issue with informal workers, with migrant workers, with self-employed workers. So it is not only the subject of the labor contract, it is also beyond the workplace. It's not only employer's responsibility. It would be very easy to say, yes, employer has to take care, let the employer take care. There is no other obligations and duties for others, but it is much beyond the workplace. It is responsibility of everybody. It should address to all health determinants, not only to work-related health issues, because when we are addressing to these factors generating health risks from the workplace, there are also environmental issues from that point of view. So they are not only occupational, but on the other hand, they are much more beyond that, like lifestyles, like social determinants of health and overall well-being, when we are talking about the health and the well-being, not only about the particular diagnosis. All other stakeholders should be taken into account and on the scene when we would like to improve the situation. And health protection is not subject to collective negotiation. We cannot negotiate and agree this is the limit, and what is above that limit we will not achieve because we have not negotiated that. So these are the main WHO principles on occupational health. And having in mind such an approach, Let me just remind you about a few documents you all know about: the Almaty Declaration, bringing healthcare as close as possible to where people live and work, and this is very important when we are talking about the national frameworks, for example, for basic occupational health services. Then in 1996, WHO Global Strategy on occupational health for all, but then what is also already mentioned is the resolution on workers' health global plan of action, and in fact we are now, member states are implementing, and WHO is giving a full support to all member states to implement the global plan of action and its main points of action. And what we have particularly in WHO European region, we have ministerial conferences on environment and health. Occupational health is a part of these topics. Last conference was held in 2010 in Parma, and there is a ministerial Parma declaration with a commitment to act, where the ministers of health and the ministers of environment have committed themselves to perform particular activities, and I will show you some of the activities which should be implemented under the Parma Declaration. They have been very few, very specific and time-limited goals, because it's hard to reach consensus, you know, when you have ministers of health and the environment, and it's a lot of politics. But there is one particular goal to be achieved, and it's in European region, and it's related to asbestos, and I will tell you later on about these activities and these obligations that should be performed. So we are giving technical support to the member states to implement this as well. And let me tell you a few words about global plan of action on workers' health. In fact, all the member states should devise, based upon this main framework, their national plans on workers' health in order to achieve a full coverage. I have already mentioned it's much beyond the contract and the full stop. All the endangered and working populations under risk should be identified at the national level, and should be proposed the way how to address to the occupational health protection for the workers, for all the workers. Then the goal is also to strengthen core institutional and human resources, so there should be the proper infrastructure, but also adequately trained human resources. To incorporate workers' health in other national and sectoral policies, much beyond the workplace, much beyond only the negotiation with the employer, and much beyond that this is only the responsibility of the employer and full stop. And in fact, to stimulate reintegration of sick and injured workers, and I really welcome very much that the Minister Deputy also mentioned this point in his welcoming address. The reintegration of sick and injured workers is very, very important. So when we are talking about the implementation of the global plan of action on workers' health, it's important to say that government should take leadership with participation of employers and workers. But the government has the responsibility to develop such a national plan. In fact, the government and the ministries are also reporting also about the data that I have mentioned on occupational diseases or work-related injuries or other aspects and other indicators of occupational health, like, for example, occupational cancer. Of course, the plans should be adopted to national priorities and needs, and if the country, like Armenia, is with a strong mining sector, then the parts that are addressing to particular risks in mining sector should be taken into account. And of course, what is the WHO role and the support, and what we can offer and the support to the member states? It's that we can make linkages and partnership with other international organizations organizations like ILO, for example, but also trade unions, civil society, private sector, to mobilize a very wide group of all relevant stakeholders and public actors. Then we are issuing guiding principles contributing to adoption and implementation of international labor conventions. Then we can support the member states in articulating their policies, giving technical support on very specific expertise and topics, in building core capacities, but I have to say, in order to address occupational and environmental risks in mining sector, in fact, much wider setting should be in place for that, and we cannot divide this from the overall approach in occupational and environmental health, overall infrastructure, policies, legal framework, as well as human resources to implement all this. And of course, there is the obligation to review the progress and to monitor it. So this year at the World Health Assembly, it will be the first report after the Global Plan of Action have been adopted, and we will report a part. We have been reporting, and the part in relation to WHO European region is included, but a lot of things and a lot of challenges are still to be done, and of course it will not be finished 2017, and we should finish what beyond. We should think about what beyond 2017. Let me come back to already mentioned ministerial Parma declaration, because it relates to some very specific issues that are connected with occupational and environmental risks. Ministers of health and of the environment committed themselves to, in fact, address to key environment and health challenges. And beside others, these include burden of non-communicable diseases, of course, and I have explained very brief the context. And in particular, to the extent that it can be reduced through adequate policies in areas such as urban development, transport, food safety, nutrition, and of course, living and working environments. That is very general. But in particular, unless we have already done so, we will develop by 2015 national programs for elimination of asbestos-related diseases in collaboration with WHO and ILO. So all the member states should have these plans if they haven't already done so. The aim is to eliminate asbestos-related diseases, and WHO position is that it should be done if the use of all forms of asbestos, including chrysotile asbestos, will be banned. And WHO is organizing every year capacity building workshops for the member states. Last year it was in November last year. This year we will have in October a workshop on hands-on training, how to, for example, calculate DALIs at the national level, how to see how big is the problem at the national level, how to develop these action plans based upon the methodology given by ILO and WHO, and we are also willing to support any member states out of these trainings by particular actions, and we are already doing so, for example, like in Albania, in Macedonia, and so on. So we are willing to support such activities, and in 2014 all member states should report on the progress of these commitments. It will be a mid-term review and a conference, so at least basic activities like the development of national profiles, asbestos profiles, as the starting point should be developed. And I would like to use this opportunity now to tell you a few words about a new strategic framework for public health, Health 2020 strategy for WHO European region. This strategy, in fact, is addressing very horizontally and is applying all of government and all of society approach and health in all policies approach. And I have to say that occupational health was applying these principles for decades, and in fact it's an excellent example how it could be done. Maybe it is a little bit forgotten now, at least in WHO European region, but this is the way how we should address to all the risks from the occupational and environmental risks, in fact, and we are very, very glad that the main public health approach is now adopting such a principle, because for example, one more time, addressing to NCDs is much, much, much beyond the healthcare system, and you will be then get completely stuck if we expect that healthcare system can only deal with the prevention of NCDs. It's much wider, and occupational health also developed the tools how to do that at the international and at the national level. So it is important to forget this. What is the main principle? That the countries and sub-regions and cities are setting common objectives, in fact, and joint investment between health and other sectors, because it can improve health significantly. It is important to have a good, let us say, diagnosis of the situation. What is the situation? But then it is then much easier to set up priority areas and to work starting from education, starting from preschool education, educational performance, employment, working conditions, social protection, and by reducing poverty. Because Health 2020 is dealing and is having inside view in health like an overall well-being of the individual and of the populations. There are four main pillars of the Health 2020 strategy: investing in health through a life course approach, and I see from the program that we will have, in fact, presentations also on aging and protection of the working population, and also we have an issues with the young workers and their protection during the work. Also an issue of children's protection within environmental health framework is extremely important. And the previous ministerial conference held in Budapest, European Ministerial Conference on Environment and Health, held in Budapest 2005, had children's protection in environmental health as one of the main topics because of children's susceptibility. Now it is nothing new, it is something that we are continuing. That means that we didn't give up. This was the focus of that particular conference, but now is the challenge to implement the activities. Tackling the region's major health challenges of non-communicable and communicable diseases, and we see from a new burden of diseases report that non-communicable diseases are really becoming much more an issue than communicable diseases, at least in WHO European region. Strengthen people-centered health systems, public health capacities, and as the fourth pillar is, and this is very much connected with the topic of this conference, creating resilient communities and supportive environments. So health promotion programs are based on principles and engagement and empowerment and offer real benefits. And one of the topics mentioned in Health 2020 is promoting healthy workplaces. This is also a part of the European strategy for control of NCDs. So in both documents, we have this as a part of the framework for action, and both documents can be used as the national, the basis for developing national frameworks. I will just say briefly a few words about this fourth pillar of Health 2020 strategies. It is good, really, that it is recognized that creating resilient communities and supportive environments is one of the four pillars that health protection of the population should be based upon, and systematically addressing to the health effects in a rapidly changing environment. We have classical environmental and occupational health risks, new and emerging, will give the basis for the further developments, because there are sectors that are developing fast and developing also new risks like transport and urbanization and energy production and mining as well. Mainstreaming occupational health into the public health and essential public operations, I have decided to mention this because this is in fact the content of the activities that should be performed within this national framework and national action plans on workers' health that are related to the health part. I'm not talking now about the activities in other sectors, but when we are talking about the health part, what should be the content, what should perform these structures? It should be surveillance of population health and well-being, and we should really have a reliable data in order to do a good planning, monitoring and response to health hazards, of course, and such a monitoring which is extremely important in environmental health in order to enable and make it possible to perform a health risk assessment. Sometimes the monitoring that are performed, for example, for air quality, for PM10 or P2.5 are such that performed in such a way that we cannot, for example, they are not continuous, so they are not. We cannot then perform health impact assessment, and the monitoring is, in fact, one of the aims is to be able to estimate impacts on health. Health protection, including environmental and occupational health and adequate services, health promotion activities and work health promotion, I should say, disease prevention, including early detection, and I would like to refer also to some activities that are performed under numerous legal acts within the member states that sometimes periodical medical checkups of the workers are seen as the preventive activities. In fact, this is not a preventive activities, this is early detection activity. Preventive activities are really requiring a very serious approach, not only from health sector, but from this all society approach. And this is a huge, huge challenge to achieve this. And all this to assure governance, public health workforce, infrastructure, financing, advocacy, social mobilization, and research for competence policy development. These are my concluding remarks. What can be done at the national level under the presented framework and the content and the international framework and obligations in some extent? In talking in terms of policies, development of national plans of action on workers' health is one of the one of the main obligations, including the elimination of asbestos-related diseases. This is included in the Global Plan of Action of Workers' Health, but for WHO European region, ministers committed themselves in particular to address to this particular activity from the Global Plan of Action on Workers' Health, and they committed themselves that each and every country will have this national plan of the elimination of asbestos-related diseases, which is extremely positive, and it's a really good guiding principle for the legislation at the national level, for the development of the policies. Occupational health services as the main infrastructure, establishment, development, improvement, because without a proper infrastructure, the activities cannot be performed. At the primary level, as the basic occupational health services or as the national centers of excellence. All three types are recommended, needed, and necessary. Interventions to provide and promote and perform interventions at the workplace in order to address to the challenges and to achieve as much as possible healthy workplaces and health promotion beyond occupational risks, including occupational risks, but also including, for example, HIV/AIDS, TB, NCD prevention, etc. Cancer prevention and control, national action plans, including actions to address occupational cancer, and always national action plans addressing cancer should include occupational cancer, and I have shown at the beginning of the presentation why, because we are addressing to some 15% of the cancers, and we cannot forget this. Evidence for action, we must have, and it should be developed at the national level, indicators, establishment of cancer registers, occupational diseases registers, for prioritization and follow-up, because without these instruments for follow-up, it won't be possible to prioritize, and to address workers' health in other policies and other processes, like SICOM, for example, green economies, or extractive industries like mining. So these topics and these points can also be used for a further discussion, and I would like to thank you for your kind attention. Thank you very much.